Welcome back to Coda Territory News at Noon. We've got a great guest today, Dr. Rob, joining us. And we get to a point now where it's the season. People are walking around and you can just sort of hear it if you listen closely, the sniffles and everything going on, and allergies becoming such a big thing. And what are some of the causes here? What makes this happen?
Yeah, you're right. I'm seeing more and more patients with allergies. And allergies are typically caused when the body's exposed to new proteins or things in the environment like mold and dust mites, tree pollen, and the body has an immune response against them, and they give the symptoms that you're describing.
And some of those symptoms, again, we've got that runny nose, those sniffles, but I've even heard of some people getting a really sore throat, things getting kind of weird when allergies start showing around. So what are some of those other signs that people should be looking for?
Yeah, allergies can be mild, and runny nose, itchy eyes, runny eyes, sniffling, trouble breathing through their nose. Some people will get a lot of post-nasal drip. They'll get drip down their throat. And they can be severe, for example, anaphylaxis, where they have anaphylaxis and sort of in between. And so most of the patients I deal with have the runny eyes and the itchy nose and the trouble with sinus infections and things like that.
And one of the best ways we can do, one of the best sources of prevention for really anything is to get out in front of it. We want to make sure that we're prepared. So is there a way we can maybe get tested for some allergies to see if there's some things that we know are going to trip these up?
Yeah, getting tested for allergies is important, and figuring out what you're allergic to, because then once we know what you're allergic to, it's better to come up with a plan on how to treat your allergies. And so we offer allergy testing. You can do sort of the traditional skin pricks in which you test certain allergens to see if you're allergic, and there's some blood tests that we can also do for allergies. But it's important in the whole grand scheme of treating allergies to figure out what you're allergic to.
And is that just something that's as easy as call ahead, make an appointment, come on in and get checked out?
Exactly. So just call our office and we'd be happy to make an appointment. We'd go over your personal history about allergies, we test you, and come up with a personal treatment plan.
Very good. Now, what are some of the things that are the most common? I mean, I'm sure there's some things that you see more often than not that trip people up.
Yeah, so the things I see in my clinic most commonly, cats. A lot of people are allergic to cats, dust mites, tree pollen, ragweed, weeds. And so it really depends on when you're allergic, if your symptoms are in the spring or in the summer. So spring are typically trees, summer grasses, and then fall weeds.
Is there anything out of the ordinary that you've seen that someone's been allergic to? We don't want to name names or anything, but is there at least something where you've seen like, oh, that's kind of weird, never heard of this before?
No, I mean, you can be allergic to anything from bee stings to, like Greg said, grass or cockroaches or dust mites. And so there's a big range of things that people can be allergic to, and we see them all.
Yeah, so what are some of the treatments here then? Once we sort of pinpoint the source of where this stuff is coming from, what can we do to sort of make sure that at least the symptoms aren't so severe?
Sure. And so when I see patients, we discuss treatment options. It's really three things that I talk about. One is avoidance. So some things you can avoid. You can get rid of your cat. A lot of people don't want to do that, but you can avoid some things. There's medications, antihistamines or nasal sprays can help with some of the symptoms. And then those patients that fail sort of those medical management, we talk about immunotherapy. And a lot of people have heard of allergy shots or allergy drops. And how that works is we test you, we figure out what you're allergic to, and we come up with a specific treatment plan in which we give you a little shot of whatever you're allergic to, and we slowly ramp up that treatment plan with a hope of desensitizing the body so you don't have near the symptoms that you would without doing that.
That's amazing. So we'll find some ways to get you out in front of it, find some ways to hopefully make you feel a little better so you can enjoy your summer. Doc, thank you so much for coming and joining us
thanks
this
for having me.
If you want to get all of them, we'll have all the information on our website at codatv.com. And coming up, meteorologist Eric Gardner says to be ready. We got a warm-up coming way out, but for now, we're going to say a little cold and a little wet. His most accurate first alert forecast coming up next.